Hello, and welcome. Today we're diving deep in the world of heart health to explore a condition called myocarditis. It's a term you might not be familiar with, but it affects many people, sometimes without them even knowing. Myocarditis is essentially an inflammation of the heart muscle, and understanding it is crucial for maintaining a healthy heart. So, what causes this inflammation? Myocarditis often stems from viral infections. Common culprits include adenovirus, enteroviruses like Coxsackie virus, and even the flu virus. Bacteria, fungi, and parasites can also trigger myocarditis, although less frequently. Certain medications and exposure to environmental toxins, such as heavy metals, can also contribute. In some cases, the exact cause remains unknown, which we refer to as idiopathic myocarditis. Autoimmune diseases, where the body's immune system mistakenly attacks its own tissues, can also be responsible. Now, let's talk about what happens inside your heart when myocarditis strikes. When the heart muscle or myocardium becomes inflamed, it swells and becomes damaged. This inflammation disrupts the heart's normal electrical signals, which control the heartbeat. As a result, the heart's ability to pump blood effectively weakens. This weakening can lead to a variety of complications, including heart failure, arrhythmias, and even sudden cardiac arrest. The extent of damage and the body's response to it largely dictate the severity of the condition. Myocarditis isn't confined to any specific age group or demographic. It can affect anyone, from young children to older adults. Determining the exact incidence is difficult, as many cases are mild and go undiagnosed. However, studies estimate that myocarditis affects approximately 10 to 20 people per 100,000 annually. It's often more prevalent in younger, otherwise healthy individuals and can be a contributing factor in sudden cardiac death in young athletes. The symptoms of myocarditis can be quite varied and sometimes subtle. Some people may experience no symptoms at all. Others might have flu-like symptoms such as fever, fatigue, and body aches. More specific heart-related symptoms include chest pain, often described as sharp or stabbing, shortness of breath, particularly with exertion or when lying down, palpitations or an irregular heartbeat, and swelling in the legs, ankles, and feet. In severe cases, it can lead to sudden cardiac arrest. Diagnosing myocarditis can be challenging, as its symptoms often mimic other conditions. Doctors typically start with a thorough physical examination and review of your medical history. An electrocardiogram, or ECG, can detect abnormal heart rhythms. Blood tests can reveal elevated levels of cardiac enzymes, indicating heart muscle damage. An echocardiogram, or ultrasound of the heart, can assess the heart's structure and function. In some cases, a cardiac MRI or a heart biopsy, where a small sample of heart tissue is examined under a microscope, may be necessary to confirm the diagnosis and determine the underlying cause. While there aren't strict classifications of myocarditis, it's often categorized based on the underlying cause and the severity of the inflammation. For example, it can be classified as viral myocarditis, autoimmune myocarditis, or giant cell myocarditis, which is a rare and aggressive form. The classification helps guide treatment strategies. The treatment for myocarditis focuses on reducing inflammation and supporting heart function. This often involves medications such as anti-inflammatory drugs like corticosteroids or intravenous immunoglobulin. Medications to manage heart failure, such as ACE inhibitors and beta blockers, may also be prescribed. In severe cases, patients may require hospitalization for close monitoring and intensive care. In some instances, mechanical circulatory support, such as a ventricular assist device, or even a heart transplant may be necessary. Preventing myocarditis involves taking steps to minimize your risk of infection. Practicing good hygiene, such as frequent hand washing, can help prevent viral infections. Staying up to date on vaccinations, including the flu and COVID-19 vaccines, is also crucial. Avoiding exposure to environmental toxins and consulting with your doctor before taking any new medications are also important preventive measures. The prognosis for myocarditis varies widely depending on the severity of the inflammation and the underlying cause. Many people recover fully with treatment, while others may develop chronic heart failure or other long-term complications. Recent research is focusing on identifying biomarkers that can predict the course of the disease and developing more targeted therapies to reduce inflammation and prevent heart damage. Studies are also exploring the role of genetics in susceptibility to myocarditis. Ongoing research offers hope for improved diagnosis and treatment in the future.